Well, welcome back. Dr. Samuel Moore of Arkansas Surgical Hospital joins us today. We're going to talk about stem cell therapy because a lot of us may not really understand what it is, what it's used for, what it can help. Welcome to the show.
Thanks
first
for having
of all.
me.
Thank you. I think we've all heard of stem cells. It's in the news sometimes. It's controversial at times. But talk a little bit about what it actually is.
Okay, I will. Thank you. Yeah, stem cell therapy is a great conservative treatment option for treating pain, especially with hip and knee arthritis. We've had this technology around for decades, but it's really about what is going to help the patient's pain and keep them functional. The only proven conservative treatment for end-stage arthritis is weight loss.
Oh.
And the only surgical proven treatment is a joint replacement for end-stage arthritis. So what we're trying to do is find other ways to keep people active even without surgery. Surgery is a proven effective treatment for arthritis, especially end-stage arthritis, but it's a pain, literally. It's hard to, you have to get over surgery. It hurts. You have to go through therapy. There's risk with any surgery. Some patients aren't even candidates for surgery because of health issues and so forth. But it's really great to offer a pain relief procedure that may last longer than some of the other proven conservative treatments.
Yeah, let's talk about some of kind of misunderstandings about stem cells and where you get the stem cells.
So the stem cell actually comes from bone marrow or fat. When we're using it for orthopedic needs, we're using it for from the bone marrow. I take it from the hip crest. It's a minor procedure where you can do it mostly interlocal. There is some sedation, and we take those cells from the actual bone marrow, using it for a similar use in the cartilage and tendons, which is a musculoskeletal system where we really need the vascularity. We don't have great vascularity on our cartilage or our tendons. Those are more fibrous tissues, and so we need the vascularity that our body is so good at healing. We just need to deliver it to those tissues where there's a poor blood supply, or it's a watershed area where there's not a great, strong blood supply, like your muscle or your skin.
So are you saying you take it from the patient for the same patient?
That's correct. Yeah, we're taking it from the patient who, it's your own cells, your body's own healing system that is in place, your immune system. And so we take those cells and we use them for similar use that they're already meant to be used for.
Right. You said you've already been doing this for
We've been doing
5 years or so?
That's right. About 5 years here in Little Rock. And this technology has been around. The dermatologists have used it, and a lot of the cosmetic needs, and as well as bone marrow transplants for different cancers and those types of things we've heard about. But we're taking your own cells. We're not taking it from any ethically questionable source, and that's reassuring.
Yeah, I think that's a lot of the misunderstanding out there. So does it grow new cartilage or new tendons within your body?
That's a great question. Yeah, we hope so. We don't have great proof of that, especially with end-stage arthritis. Bone-on-bone arthritis is more of a shear force problem. We're talking about a surface that's now as smooth as a bowling ball. If it's bone-on-bone arthritis, it's really hard to get a cell to stick on that, if you could think about the physical strain there. But we do see that these cells are potential cells that are going to be tissue someday. We just want them to be cartilage tissue. And so the proof is not there that we are growing new cells. We have some good early studies in animals that show that, but we're really not able to confidently say with evidence that we're growing new cartilage. We hope so.
Not quite
we have
yet.
seen the studies that show 80 to 85% of patients that get pain relief, which is what we're kind of promoting is, hey, this is another conservative treatment option, a pain relief procedure.
Another option, and we were just talking about how many orthopedic surgeries there are now with so many people living longer, and our joints are starting to wear out. But that's a good thing, you know, that we're living longer and that we need these kinds of services. What are you hearing from your patients? You've been doing this for a few years now, and what's their reaction to it?
For the most part, patients are getting pain relief. It may not be from 10 out of 10 pain to 0 out of 10 for some patients, especially end-stage arthritis. But we are getting the vast majority of our patients, they have significant pain relief. And the next question I get is, am I a candidate for it? Well, we don't know. That's where all the research is right now. We know that if you're bone on bone, you're not going to do as well as somebody who's got early arthritis. But we do see that the more we can keep you functional, and hopefully try to avoid any trips to the OR for a joint replacement, then the better your function will be. Sometimes it comes down to, we've tried everything conservatively. You may need a joint replacement to get your function back, and that's the goal.
Yeah, but it's just another option out there, along with maybe steroid shots sometimes are used for this as well. So just sometimes you have to try and see what works.
And you're right, there are a few other conservative treatment options: physical therapy, bracing, steroids, gel injections, weight loss, as I mentioned. Those are all proven to be short-term relief only, and some of them don't work at all. And so we're really trying to do things to keep patients from having to go through that surgery unless it's necessary.
Okay, well, we want to put up the information about, of course, the hospital, Arkansas Surgical Hospital, because this is really new science, and you guys are on the cutting edge of it. So, yeah, if you need to be checked out, they just need to make a call and make an appointment.
You can get in touch with us at arksurgicalhospital.com, or certainly get us drsamuelmoore.com is a great resource for online information.
There you go, and that's him. Thank you so much for coming in and telling us
much
about this, and congratulations on this new science going on there.